Hello, and welcome to this week's tasting flight of tips to keep you rooted in your daily practice. My name is Tina Clark, also known as Teacher Tina RDH. I'm a dental hygienist, educator, speaker, and author. Basically, I like to share information with others, so let's dive into this week's topic.
Oh my gosh, you guys, I am so excited to talk about this week's topic. It's one that's near and dear to my heart. It's anesthesia. So, more specifically, it's anesthetic. And we're actually going to be looking at the finer details of the anesthetic cartridge. So, did you know that the anesthetic cartridge actually is color-coded? I know, it's really cool, right? Every single anesthetic has some sort of color coding system on it. And it doesn't really matter which manufacturer it is. They all have just this kind of universal design to the color coding system. So for example, 2% lidocaine with 1 to 100,000 epinephrine is going to have more of a red band around the anesthetic cartridge, making it easy to identify, right? You look for the red one, you know that that's 2% lidocaine with 1 to 100,000 epinephrine. Whereas something with a blue band like this is going to be your 0.5% bupivacaine with 1 to 200,000 epinephrine. You may know it as Marcaine, but yes, bupivacaine will have that blue band, right? So, which makes it really cool and easy to be able to quickly tell and differentiate between the two. But here's the thing, sometimes those anesthetic color coding systems will be very, very similar. Like, for example, 4% articaine with 1 to 200,000 epinephrine is going to have more of a gold band on it, which is really pretty. It makes it easy to see. And I love septicaine, articaine, however those are the two names. Whereas something like 3% mepivacaine plain is going to have a tan band on it. Now, at a quick glance, those two anesthetic cartridges look very, very similar, but in actuality, they are very, very different drugs. So it's really important to double check and make sure you're either looking for that sparkly gold or more of a flat tan. The other thing that we have to remember is with our anesthetic drugs, you could have the same anesthetic type, but based on if it has vasoconstrictor, the amount of vasoconstrictor or anything like that will change the color of it. So for example, like 4% prilocaine plain or CETNS plain will have a black band around it. Whereas if it has epinephrine in it, like 4% prilocaine with 1 to 200,000 epinephrine will have a bright yellow band. So you can have the same anesthetic drug, but also the color variation will tell you what the type of solution it is. So just because it's the same drug doesn't necessarily mean you're going to have the same vasoconstrictor in there, okay? So those are just some little quick tips when you're looking at the anesthetic cartridge itself. Now, talking about a little deeper look into the anesthetic cartridge and double checking things that you've got the correct color for the drug, I want to tell you to do another little double check and look at the expiration date. Now, I know sometimes you go, yeah, okay, of course, but like everything else, there's an expiration date. And this is especially true when we are talking about our anesthetics with vasoconstrictor. Now, the reason why is our anesthetics with vasoconstrictor actually have a preservative in there, a sulfite, which is why we want to know if somebody has a sulfite allergy. The anesthetics with a vasoconstrictor have a sulfite in it, a preservative. It's very common food preservative as well. And that actually keeps the anesthetic solution stable, which is really, really nice. We want to be able to make sure we can use that anesthetic from the time it leaves the manufacturer's warehouse all the way to our dental office. Now, if an anesthetic solution has expired, that also means that that preservative isn't doing its job, which in the long run impacts you and your patient. Like they may not get as numb or have the profound anesthesia that you want, or maybe even some other side effects. So really double check that expiration date and make sure that it really is a current anesthetic. All right. Now, one last tip when we're talking about cartridge, I want to encourage you to hold on to all of those cartridges after you've done your anesthetic and wait to safely dispose of them until you've done your chart documentation. It's really important to make sure you've put the correct anesthetic solution, whether it's 2% lidocaine with 1 to 200,000 epinephrine or 4% articaine with 1 to 200,000 epinephrine. You have to know the difference between those. So make sure you're putting the correct drug name, the correct amount, and you know what? It may not even be a bad idea to note when that anesthetic solution expires. You know, and I've actually even heard of some offices that will put the lot number, which you can also find on that anesthetic cartridge, into their chart documentation. Either way, it's up to you and your office to make the decision on how you want to handle all of those situations.
Thanks for joining this week's Tasty Tip. Make sure you tune in next time for another round. In the meantime, I invite you to join me on Facebook and Instagram. You can find me by searching for Teacher Tina RDH, or you can check out my website, www.teachertinardh.com.